3.
Hello everyone. Today we are going to present on the topic opportunities of adopting AI-powered robotics system for tackling COVID-19. Now let's look at the topic, and the members that's going to present the topic are Kirthika, Subiksha, Sujal, Kajol from Sri Sairam Engineering College, and which is guided by Dr. Mithilesh Satyanarayanan. Now over to you, Kajol.
The whole world is fighting against an invisible, indestructible virus with utmost patience and intelligence. A pandemic longer than a year may drag us into business failures, mass unemployment, and a world thrown into global recession. Undoubtedly, in this scenario, medical care centers are the backbones of every nation. Our world is blooming into a digitalized capital where there is humongous implementation of robotics to get several things done with. AI powered robotics can effectively support healthcare and well-being areas during pandemic by tracking health conditions in real time, creating virtual visits and telemedicine visits for patients. However, it's challenging to get these technologies on ground in full swing, keeping the social and the ethnic hindrances in mind. So, here we are present with a glimpse of current opportunities and challenges with respect to AI powered robotics to scuffle COVID 19. Over to you, Sujal.
Okay, now let's look at the topic of 3D printing and how it has changed during the pandemic. It's also used in medical industries from scanning to surgical masks. It has been immensely rewarding during the rampant. 3D printing has been like a pillar. It has not only enhanced the working ability, but also has made the material cost effective. So, whether it be from a healthcare industry or from food and drug administration industries, 3D printing has been of great significance. Electronics industry uses 3D printing to print conductive and insulating structures in conjunction. Spare parts are also being produced by the manufacturing industry. Now, to the next slide, we look at how the frontline workers have benefited through autonomous robots. Self-governing systems were of great help during the pandemic. It's also fostered in medical centers and research labs. Patients' reports are generally prepared using handwritten notes or reports, but due to the advancement in the digital technology, autonomous robots can prepare the reports of the patients. Diagnostic tests such as swab tests are also done by wheeled robots. Next slide. Next slide says that how the medical supply chain has affected during the pandemic and how these autonomous robots have affected. Surgical robots and other robots have been deployed in this sector. Medical experts save a lot of their time and incentives as well. Accurate surgeries are performed at all times as what we know the robots for. Robots are prioritized in emergency situations as they are more reliable and quick in action. Over to you, Kritika.
Next slide. Digital communication during pandemic. Effective communication in this time of pandemic must incorporate ideas and strategies so that people are unharmed. The communication must not only be comprehensive and based on true facts, but it must be fast enough to reach the target community such as health workers, hospitals, and the public for them to take up immediate action wisely when necessary. The use of apps or instant messaging services must be enabled. And it also helps to avoid physical interaction and enables people to maintain social distancing in person as per the WHO guidelines. Next slide. Robotic guidance and assistance for a much better life. With the introduction of remote controlled medical robots, such as the ones invented by AnyBots, caretakers keep a track of health conditions of patients, make necessary arrangements for regular checkups, and even book appointments as per the requirement. It enables the reiteration of connections of affected people to alarm the rest of them. It is a human sized robot, and it is the combination of cutting edge mechanization and human touch for assisting the medical staff in providing frequent checkups and nursing patients personally at at their residence if required. And it is a machine that can work continuously with better accuracy and reliability. Over to you, Subiksha.
Perfect for deliveries during pandemic. With the combination of mobile technology, autonomous robots, and partnership with the stores and restaurants, the delivery has become much faster than before. MNCs are investing in such kind of delivery bots because those who living in cities expect the immediate and scheduled delivery for almost everything. The compartments in these robots are locked in such a way that no one can steal the things that's inside it. Benefits of these kind of delivery robots are this can significantly decrease traffic congestion, reduces delivery cost, and reduces the infection among people during the pandemic with its contactless delivery. Use of social robots, a tireless companion. They can interact with humans. They can convey intentions in a human perceptible way. These are companions for elderly people who has health issues. They can also play the role of a tutor for children at home. Few say these are a greatest companion for introverts. These kind of robots can also do household chores. Telemedicine and remote patient monitoring system. Telemedicine plays a vital role by allowing patients to stay and receive care at home whenever required. These allow regular basic medical care and electronic prescription. Besides doing these, it also provides secured bracing of COVID-19 patients. Robots enters into healthcare units where critical patients are kept, and nurses, health workers can handle them remotely. They can also transport delicate and dangerous materials. These kind of robots are gradually accelerating across the world. They help to avoid overcrowding of emergency rooms during COVID-19. Over to Kajol. Over to Kajol.
Robots performing the surgery can be carried out in a less inhibitory manner, with surgeon handling the robot at a safer distance. Hence, the surgeries can be economical as minimum staffs would be required. The size of the incision made by a robot would be comparatively smaller than the size of the incision made by a doctor. Smaller the incision, quicker would be the recovery of the patient. Due to this, the shortage of the beds in the hospitals can be managed well. As the recovery rate increases, the vacancies for bed would also increase proportionally. The advantages of this are robots can work tirelessly, which is why they are more accurate and efficient as well. Therefore, the frequency of number of surgeries can be conveniently increased. Keeping all these things in mind, we can say that surgical robots are the new friends. Next slide. Now, coming to triage and the risk management. There is an alarming situation in the world which has created uncertainty among all of us. In order to assure the allocation of resources, video conferences can be very useful and comforting for many patients. Getting regular checkups and monitoring the patients can be executed using video conferencing and FaceTiming. Severely infected COVID patients are televised by lively evaluation of immunological characteristics and testings. Robotic monitoring system having special feature of both sanitizing and detecting the infection and intimidating the same to the authorities so that they can take timely actions. A robot sanitizing itself before and after use is a future we envision. Artificial intelligence is likely to be either the best or the worst thing to happen to humanity. This is a very beautiful quote quoted by Stephen Hawkins. Thank you all. Have a glorious day ahead.